As we all know, 2020 has been a long and tumultuous year with millions of people's lives across the globe literally turned upside down because of COVID-19. And as this year finally comes to an end, the vaccine is finally here. But how quickly will the general population receive it? And could this really be the light at the end of a very long and dark tunnel? Back with us to discuss this topic is our good friend and top infectious disease specialist, Dr. Brad Spellberg. Now, recently, the head of the CDC predicted that total deaths from COVID-19 could reach close to 450,000 by February, unless a large percentage of Americans actually follow precautions like mask wearing. And if they don't, he said this winter will be, quote, the most difficult time in the public health history of this nation. So what do you think about these statements?
Well, it's pretty sobering, isn't it? And I have to tell you, it's what we're seeing on the ground right now. COVID is completely out of control in the United States. And one of the real fears is that as the vaccine shows a light at the end of the tunnel, people stop really focusing on physical distancing, avoiding crowds, washing their hands, wearing the masks. That tunnel can still collapse in on us before we get to the vaccine. Let's not get short-timers disease. We need to continue to focus.
Now, let's talk about the vaccines. I mean, here we are. The vaccines are here. We've been talking about it for a very long time. Let's kind of go through who will be getting the vaccine first. The CDC, of course, is the body in charge of setting the recommendations. However, the CDC is not law enforcement. They don't enforce the order or the prioritization. The state and the local jurisdictions will decide how they follow the CDC's recommendations. But first up, healthcare workers, frontline workers, and those living in long-term nursing facilities.
Yeah, that's exactly right, Dr. Ian. The CDC has set a recommendation. States and local governance will then figure out how to implement. What the definition of healthcare workers is something we have to figure out. It depends a little bit on how much vaccine becomes immediately available. If we have enough vaccines immediately available, we'll vaccinate all doctors and nurses and anyone who is in immediate direct patient contact. But that may take a month, 2 months, 3 months, in which case we may have to start honing in. Maybe we start with the emergency room physicians, the ambulance workers, the ICU doctors that are really at the highest risk, even amongst the doctors and nurses. And then as the supply chain expands and more vaccine becomes available, it will then gradually open up to more and more people.
If you break the numbers down, you're looking at, they say, about 40 million doses of the vaccines available by the end of 2020, the end of this year. And it's a 2-shot vaccine. So you're talking about 20 million people being able to get it by the end of the year. That covers healthcare workers and some in the long-term home facilities. Now, then you talk about maybe 5 to 10 million doses delivered per week. So when you do the back of the napkin calculation, you're looking at probably late June before most of the population has a chance to be vaccinated.
Yeah, that's absolutely correct. I mean, if we could get to 80% of the population vaccinated by the end of next year, that's a huge win for all of us. I do think it's important to recognize that respiratory viruses typically peak in January. All respiratory viruses typically peak in January. If we can make it to April, May, June, with expanded natural immunity from the number of people infected and hopefully waning caseloads just because of the environmental changes as spring goes into summer, plus a large number of people being vaccinated, I think we're all hoping we will be far past the worst of it if we can get there.